My name's Ambrose. I'm one of the lecturers here at Keele. I'm also the admissions tutor for the physiotherapy programme. I actually first came to Keele in 1997, and I came as an undergraduate student at the time, and I graduated in 2000. And luckily got myself a job in the NHS not long after, and I came back to Keele in 2004 to work as a full-time lecturer. Some good things about the programme. I personally believe that here at Keele we work in collaboration with our students. It is not a one-way relationship. There's plenty of times I've learned things from students, both when I'm actually in the teaching room or on a one-to-one. We do dissertations here. We ask students in their final year to do their own research project. One thing I think we do well at Keele here is we have a very good relationship with our students. It is definitely a two-way relationship. There is no kind of dictatorial regime or anything like that at Keele. We do ask our students to work hard, and our students do work hard because they actually enjoy the programme here. We've got a very good personal tutoring programme, so we actually help guide you through the 3 years at Keele. Whether you're here as an 18-year-old school leaver or as a mature student, your needs are going to be very, very different, and what you want to get out of the degree may be different, and we can accommodate that using our kind of interpersonal and personal tutor system. But at Keele we ask our students to conduct a research study in their third year, and the students actually like that, and that is different than a lot of universities. A lot of universities don't do that anymore, but at Keele you will embark on your own research project and do a research dissertation for your final year, and that gives our students something a bit different that they can go to interview with. We also have a very good exercise stream through our programme here, and at Keele we do bring lecturers in who aren't physiotherapists. We have an exercise physiologist and a biomechanist here as well. And that adds to our breadth of experience and our breadth of what we can offer at Keele. From a staff point of view, we find that our students really engage with each other very well from the word go. We have a very, very strong set of reps in all of our years, and they arrange everything from social events to the actual balls that we go on, and I as a member of staff always go to all of the balls, and that's kind of underlines the relationship we have with our students here. One thing I will say about our course here at Keele is we're very, very diverse. We have a diverse range of students from different cultural backgrounds, from different ages, and that really adds to the breadth of experience and the breadth of relationships that are built on the programme. The way we structure the programme at Keele is that you are in for quite a lot of the first year, but gradually as the 3 years progress you actually take on more independent activities, and actually in the final year more or less all of your course is geared around your individual learning objectives. One of the big advantages of our third year is that we have a module that's specifically around policy and around about healthcare policy, which arms our students with the ability when they go to interviews to actually discuss the different political environment and the political changes that are happening in the UK health sector. Our students, they do find that difficult. They don't necessarily think that's going to be part of their physio programme, but at the end of it they really see the benefit they've got, and especially in the job market when they can actually go to interview and talk to employers and talk to managers about these different policies that are affecting the way in which physiotherapists actually work. One thing we have been looking at Keele is finding new innovative ways of actually learning and delivering our teaching material, and what we have been doing is actually allowing students access to downloadable podcasts which we develop actually within the school. This allows students to put these videos onto their iPods or onto their mobile phones so they can look at different aspects of anatomy. So we have ones called Muscle in Action, and students will actually look at these videos. I've had students who are making the toast in the morning and are actually looking at these podcasts on their phones and actually learning anatomy outside of the classroom. This is some of the things we're doing. They're fully embedded into our virtual learning environment, which is another activity which we use quite heavily within the school. We also use lots and lots of electronic resources to actually help you guide your own learning. So we have work packages which are web-based, we have self-assessments which are web-based, and you can do those over and over and over again, which allows you to gauge where you are in your learning. So if you are struggling with certain aspects, hopefully those assessments can help raise that, so you can actually either get a tutorial or do some of your own study. All of these activities make sure that although we are delivering a programme to up to 80 people, it actually feels like it's individual to you, because you can hopefully tailor some of these activities around the way that you learn best. We're always looking for new innovative ways to deliver teaching. We don't want to stay still. We're not comfortable here. We always want to make things better, and hopefully that ethos that we can put into our course you'll be able to pick up on and be able to utilise yourself as well. So hopefully what I've said is really giving you the initiative to come and apply to Keele. If you want a final word, if you want me to sell it to you, I came to Keele as an undergraduate student. I came back to Keele to do my postgraduate study at a master's level. I then came back to Keele to actually work here as a lecturer, and now I'm still at Keele now doing my doctorate, or I'm doing it in education, but Keele offers me the ability to be able to do all of these things in one place. You know, I live at Keele as well. It's a fabulous environment, and I came from an inner city area. You know, I was brought up on the big city, but somehow Keele connected with me, and I actually enjoy living at Keele, and I actually work here and get paid for something that I love to do.